Disclaimer: the content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. And now...
Yeah, we don't want to do anything to scare your children. That's the last thing we want to do. We don't want to scare anybody.
Ladies and gentlemen, please welcome Ben and Amy on the Heavy Truth.
Hello.
Hi.
Welcome back to another episode of The Heavy Truth.
Welcome back.
Hi, Ben. How are you?
I'm good, Amy. How are you?
I'm well. I'm excited to have another episode of education here for our lovely listeners. This one in particular is a topic that I have been asked by a few people to discuss. And although it may not pertain to everyone, it's not going to pertain to everyone, but we're going to add a couple things in there that everyone could benefit from. So what are we going to be talking about today, Ben?
I don't know, Amy. You tell me. These were these people that told you that they wanted you to talk about something. What's the topic, Amy?
So we're going to be talking today about a condition that is quite rare, I guess I would say. It is
Hidradenitis Suppurativa, HS.
HS.
Mm-hmm.
It's a skin condition, which is very painful.
Mm-hmm. It is chronic.
Chronic, specifically, it is a chronic inflammatory skin condition, and it's characterized by painful abscesses, nodules, scarring, and it primarily affects the creases in our body. So like armpits, groin area.
So basically like the areas of the body where skin rubs together, right?
And sweat.
Mm-hmm. And we'll be just calling it HS because I'm not going to keep saying hidradenitis suppurativa each time.
Yeah, no, because, and it's always a big joke for those of you who listen to us frequency. Here I'm talking about the words. Yeah. Frequently, Ben always likes to call me out on words that I can't pronounce properly.
Like this one?
But what people don't understand is that he practices the word for numerous times before we go on, and it makes me look like I don't know what I'm
Does that sound like I've practiced this?
And I'm just like, yeah, I just can't say it. So what are we talking about today? Mm-hmm. But I do know a lot of people who
funny
suffer.
Story, when you first sent that to me and said, we're going to talk about HS as a nurse, right? Because we're both nurses. I'm like, HS, that's like a bedtime snack, the HS time, right? That's when we give meds at HS at bedtime. I was like, why are we going to talk about HS?
I was dying.
And then I was like, HS question mark? I'm like, okay, we're going to talk about a snack at bed. HS. Okay.
Yeah, no. So, and even like working in primary care, and I don't know if you maybe have dealt with a little bit of this in urgent care.
When I was in the urgent care setting. Mm-hmm.
Yeah,
for sure.
And I dealt with it a lot in primary care as well. Mm-hmm. But I see a lot of patients that they don't always complain about it to me, although I do see it in their history. Mm-hmm. So if I bring it up to them, we'll talk about it.
A lot of times these people have already dealt with this in the sense of they've talked to their primary care providers. They are now seeing dermatologists or internal med docs or something, to help with this. But as our job as providers, and we see them, right? Because as we said, it deals with areas of the body where the skin rubs together, and then that, of course, with obesity, we have that skin folds and things like that. So it kind of goes hand in hand, right?
Mm-hmm. Yeah. I mean, what it, really it involves follicular occlusion. So like in the follicles.
Look at you with that word, follicular.
Follicular. And that's kind of a fun word, right?
Mm-hmm.
And, it's immune, there's an immune like dysfunction and chronic inflammation. So we know obesity is a chronic disease.
Mm-hmm.
There's chronic inflammation with that. Obesity is an inflammatory process.
Right.
So when we talk about this condition, which again, for people who don't know, it is extremely painful.
And let me throw out there that it is more common in women than men and people that have a family history of HS, right?
So there's no cure for it. All we can do is help treat it. And, doing that is decreasing our risks. And like, you mentioned, obesity is one of the risks. So we want to try and reduce BMI, weight. We want to try and reduce or improve dietary habits, because we know that if we're eating a diet high in inflammatory foods, which we're going to talk about a little bit, it can worsen symptoms if you're eating a high inflammatory diet. So, studies have shown that, people with HS are 3 times more likely they are also obese. So there's definitely a big correlation between the two. And helping individuals with this condition is, not only is it going to help them physically, but mentally, when you deal with a chronic condition like this, it's painful. We want to try and any way you can help alleviate those symptoms is going to help you.
Right, because ultimately it's a combination, right? That's going to happen with these lifestyle changes, right? Because you'll have to do, many different lifestyle modifications, and it's not just diet, right? There has to be good hygiene, and to help these areas where the skin does rub as well, right? You want to keep it clean and free of moisture, and looser fitting clothing to reduce friction. Bring it up to your primary care provider, right there, because there's lots of things. There's different methods of or different modalities of dealing with this. Our from our aspect of would be the weight management part in dealing with obesity. But I think as a more holistic, there's other, it plays into a bunch of different factors, like you said.
You remember when we were in San Antonio and, we met that individual that was promoting that self-wicking fabric or whatever? Do you remember that?
And it had some kind of like a silver nitrate or something in it, and you put it in the areas and it wicked the moisture away.
Yes.
Yeah.
So that is something that would be so beneficial. And I'm just thinking this through as we're just sitting here doing that. Like, I haven't offered that up to any of my patients who have this, but again, because it is friction and wet, it's moist and that causes irritation as well. So that might be something that could help, potentially with discomfort.
Of course. And there are many different kinds of, like you said, topical therapies, systemic therapies, right? Pain management, medications, and sometimes surgical options, right? To deal with all of this. But, with the realm of obesity, there are other things that we can do to help, right? Obviously, reducing the weight can help with this, but then I ask myself, and I'm asking you, reducing the weight sometimes makes the areas of loose skin, which again then can be problematic.
Yeah, definitely. But then again, is it just because we get the loose skin that's causing the problems?
Right.
But hopefully we have decreased some of the inflammation associated with it, which then would
go on.
Which would just decrease the risks of maybe a flare up.
Oh, true. I was just going to say, because it does flare up, right? It does come and go. And I've seen that patients that, they'll be on an antibiotic of some sort of oral antibiotic because they've had a flare up, or, have they seen general surgery to help drain the lesions and things like that, Yeah.
Yeah. And I, of the individuals that I have with this condition, all of them are on GLP-1s and have noticed a significant decrease in flare-ups since being on those medications.
Are there specific GLP-1s that work better than the other, or just
the injectables, right, that we're using right now, because we know that those, they help in many different ways, and we've talked about GLP-1s already here, but it helps with insulin resistance and, the way you process insulin and store fat and sugar regulation. So it just helps with overall inflammation. So when we talk about trying to have, what are some things that we can do to help our dietary intake improve? Well, what is it? It's a low inflammatory diet, and obesity is an inflammatory process. So having low inflammatory foods are helpful, just in general, because people come in, their back pain and knee pain, all kinds of just pain in general because
arthritis,
yes,
all kinds of arthritis,
yep.
RAs,
So if you're consuming a diet high with, inflammatory foods, whereas in, previous podcasts, we were talking about ultra processed foods, they're very inflammatory, like they cause a lot of inflammation. So now we're switching gears to, now let's talk about some low inflammatory foods, and how is that going to help reduce systemic inflammation and just improve overall health? So, some ideas as far as, and this episode will help other individuals because, again, having a lot of inflammation causes a lot of extra pain. So, first starting with, fruits and vegetables, we know that berries are great. Berries are great.
The snozberries taste like snozberries.
Where's that from?
Willy Wonka.
That's right. Yep. That's right. And
remember when we
blueberries?
We were, I'm going to on my own world. Remember we went to the Epic campus outside in Verona?
Yes.
And they had that whole wing of Willy Wonka, and then they had the wallpaper of the snozberries, and you have that weird video of me pretending to lick it, saying the snozberries taste like snozberries.
That was so
fun.
Cool.
We need to go back again where we have more time, where we can see other places, because we were a little, I guess with producer Mike, because he's having FOMO.
Total FOMO.
For those of you that don't know, fear of missing out, FOMO.
Yeah, but the history behind that is that he was off fishing,
probably trying to catch salmon, which is another good source of protein, but also a low inflammatory idea. Although I did look that up, and some suggestion was a salmon salad. Ugh, sorry, that's just my idea. Yuck! If someone gave me salmon salad, I'd be like, I'm good with my processed crap. I don't want the salmon salad. But back to the fruits and veggies. The berries are great, right? Apples, also a good source of fiber. So those of you on a GLP-1 who may be experiencing some constipation, this will help you poop. Right? Oranges are great. Pineapple, grapefruit. But I remember back in the day, the grapefruit diet, everyone just had half a grapefruit for breakfast and you lose some weight. I remember that.
I like grapefruit. Do you like it?
Do you like it? What, mixed with a little vodka? That's called a Greyhound, girl. That's not breakfast.
I've actually never had a Greyhound. No, I'm talking about a ruby red grapefruit.
No, I was one of those fat kids, and I can say that because I was a fat kid that would. And this is going to date myself. Cut that in half and sprinkle some Sweet and Low on it. Remember? Ugh,
so you did eat it.
Because in my mind I was like, I'm going to be thin.
Yeah.
Girl, no. I mean, then I followed that with 2 bowls of, like sugar pops. So that probably was not helping. But, and many vegetables are great as well, right? The leafy greens, like spinach, kale, Swiss chard. Kale freaks me out to this day.
Kale?
Yeah, because growing up, kale was always something that was a garnish, right? Around a salad bar, there was always that fake kale or...
oh, is that what was there? I don't know. Yeah. I mean, we've made kale chips before.
Oh, sad.
Yeah.
Yeah.
It's healthy.
So when I see that now, I'm always just like, oh, no. And I don't like spinach, so...
It's good blended into stuff. Like
what would you blend that
smoothie?
Into? Yuck. No.
Okay.
I mean, if I'm not tasting it, maybe, but...
What about a salmon smoothie?
Girl.
Size.
Salmon, no, all of that is gross.
Salmon
That's
mousse.
not-
You seen
I
that?
love fish. I like
Yes.
fish, but I just can't with salmon. And I just say that, sorry, the reason we're stuck on this is because today at my home this morning, I was leaving and there was a container of pistachios. And I said to my husband, what is this for? And he said, oh, well, I found this really good recipe for this pistachio covered salmon. I was like, oh, nope. He's like, oh, well, I guess I'm just going to stop there. Yeah. No to the salmon. And Mike, back to that question you asked me, producer Mike. Yeah, you'd think he'd learn after 12 years together. I never ate salmon. Not going to eat it now. If it's got skin on it when it comes out being cooked, no. And never serve me that fish where you still see the eyeball because that's going to go right on back. Or a fish where you get it and its tail is in its mouth. You seen those like a fancy presentation? No.
Sardines.
Gross, no.
Yeah, see, that's another.
But those are a good source of good fats and good proteins.
the omega-3s.
Omega-3s. Back to the vegetables. I do like broccoli, Brussels sprouts, cauliflower, carrots and beets. I do like beets. But you and I always talk about a good beet salad, Amy.
Love it.
Yeah.
Love it. That sounds
Sweet
so good.
potatoes. I'm not a fan, but
I'm not a fan either, but they do have some anti-inflammatory properties to them. But, again, going to the fats, olive oil, which is good. You said the fatty fishes. So salmon, sardines, trout are a good source. Mackerel.
No. Tuna. Tuna's good. I like tuna.
Tuna. Yeah, I like tuna as well. Nuts and seeds. Almonds, walnuts, chia seeds, flax seeds.
Chia.
That's what I think of when I hear do you eat chia seeds or flax seeds? Do you add that to anything?
I don't.
I don't.
If it's in something, I do.
That goes in smoothies too, chia seeds.
It does.
Oh, I'm never having a smoothie at your house because apparently producer Mike is going to put this chia seed crap and kale and possibly salmon now. So no.
Well, you did try. There was a chia seed pudding or some type of dessert that we ate on our cruise. You had some of that.
Oh yeah, I don't. It's fine.
Yeah.
Chia seeds and flax seeds are fine. I
But just regularly you don't.
ate that dessert and immediately went to the bathroom to poop because that was going back to the ocean very soon. But I don't go out of my way to like add chia seeds.
That was my question.
And I'm sure everyone hears that in their mind. Chia.
Yeah.
Right.
They have so many. Speaking of chia things, they have so many like different
Chia pets, chia head.
I got none for Christmas, Amy.
I did really look. He wanted the.
They had the Homer Simpson like in the wall, the hedge when he goes into the hedge.
I grew one of those one year, and after it sprouted at a certain point,
It got brown right away, right?
Yes, and I threw it in the trash.
Yes, I know.
It was a gift one year that my family did white elephant, and it was funny because five of the 13 of us gifted the chia pet things to people.
But to be fair, Mike, I did look for Homer, and
She didn't look too hard because you probably could have just gone on Amazon and found that. But anyway, back to the proteins, like we had talked about, right? Plant-based products, right? Lentils. I know you like a good lentil.
I do.
Chickpeas. I do like chickpeas. What's the other name for chickpeas? Garbanzos. Yes, garbanzo beans. Black beans are good. Hummus, yes. Tofu or, how do you say that? Tempeh?
Tempeh? Yeah, that's what I was asking you if you've ever had it.
I know what it looks like.
Thank you.
Just like tofu, it's kind of like flavorless. And when you cook it, whatever your spices or whatever you're using, it takes on that flavor.
The flavor.
Eggs, some of the grass-fed beef in moderation, right? Turkey, chicken, things like that. Whole grains, we talked about, or we suggest, right? Brown rice, oats, quinoa, or quinoa, as some people say. I just laugh. Quinoa. And if it is pronounced quinoa, which I know it's not, don't come at me. It's quinoa.
Yeah.
Oats, buckwheat, barley.
Some herbs.
Herbs and spices.
Yeah, with turmeric.
I hear a lot of noise about turmeric. People ask me about that all the time. People would drink turmeric juice and carrot juices with turmeric.
I think
it has good anti-inflammatory, which we're talking about. Good anti-inflammatory qualities, right?
One of our cardiologists that we work with likes turmeric, right?
Jeff. Yeah.
I think so. Yeah. So maybe we'll have to get him on and talk about some. We are going to have some guest speakers coming this year. So definitely a cardiologist. We're going to have a dietitian.
A dietitian, yes.
For sure. We're going to have one of our a bariatric surgeon that we work with.
Oh.
And we're also going to have our health coach, personal trainer.
Oh, health coach Mike?
Health coach Mike.
Oh, a different person from producer Mike.
Yep. Even though
Gotcha.
producer Mike is a health coach. This
we
one's a
also
personal
are going
trainer.
to have a GI provider.
Love
will
it.
be on as well.
Love that.
Yeah.
So we do have some guest speakers coming up, so that'll be exciting as well. And actually, I don't know about you, but for me anyway, people are always like, "When can I be on your show?" They say it all the time, right? And then
Mike's
I'm just
mom.
like,
Producer Mike's mom.
"That's right."
She thought she could call in.
She wanted to call in.
This is not Delilah After Dark. We're going to request your favorite song.
Sorry,
I'm sorry.
Janet.
She didn't even pay for the meet and greet. Ben.
Yeah. She came over to your house today to meet me, and I was like, I don't think she paid for the meet and greet.
No autographs.
Yeah, no. She got a hug. It was one of these like, oh, yeah. Tap, tap. Next time, pay for the gold charge, and it would have been, something different. Maybe an autograph or a selfie, who knows?
You're not that big of a deal.
Well, Amy, didn't you say that people always ask you when they can meet me?
They do. Probably because they're just, I think they're intimidated by you.
Enthralled.
Intimidated. Like
by Dr. Ben?
Who's that sassy?
By Dr. Ben, not just average APC Amy? Okay. Anyway, beverages, green tea. Green tea is a big thing. There's that turmeric again, turmeric tea. Herb teas like ginger and chamomile. Water with lemon. I feel like that's a little boring. Although, cold water. Tea, yeah, well.
Iced tea with lemon, it's fine.
What about foods high in antioxidants like dark chocolate?
She's moving us along. I don't like dark chocolate.
I do.
Do you?
Pomegranate?
Pomegranates are good. Yeah.
Like they used to have, Costco used to have like the containers of like 4 or 6 of them, just the big pomegranate seeds. Have you ever?
What would you do with that?
Well, you just eat them. But
What?
have
No.
you ever taken out the seeds of pomegranates out of a pomegranate, like
She's
fruit?
trying to say fruit.
Have you ever seen that?
Have I seen it? Yeah, I see it on TV all the time when people do it.
It is the most disgusting maneuver ever.
You just cut it in half and bang it out. That's what she said. Sorry, I had to say that.
Wow, we went there. The eyes. My eyes looked at both of them, and there they went.
Producer Mike mouthed it. I decided to say it.
No, it is so. I don't eat. What is that condition where you don't like the pod look?
Oh, that weird thing that looks like the eye. Yeah.
You know what I'm talking about?
Yeah. Well, it's not.
With the holes?
Yes. Producer Michael, look it up.
Disgusting.
But I do like a good veggie with hummus. I just saw that here. Cucumber slices, bell peppers. Those are good.
Love it. So a couple ideas for some low inflammatory meal ideas. All right. So I am thinking for a breakfast idea.
It's not going to be that salmon salad.
No, well, not for breakfast, but like a smoothie with spinach, avocado, blueberries, some flax seeds, some unsweetened almond milk because almond milk is low inflammatory. That would be a decent low inflammatory meal option.
That sounds like a crap smoothie at your house. I am never coming here for breakfast.
But we're talking about an anti-inflammatory meal idea. But you don't necessarily need that. But for our listeners that need and that want to do more anti or low inflammatory meal ideas, that's for them.
Yeah, that's good. Just take a note, listeners and guests coming to Amy's and producer Mike's for breakfast. Not that smoothie.
Or how about a little oatmeal topped with some raspberries or blueberries with a little chia seed and then a little drizzle of honey. How would that be?
Well, you could skip the chia seeds and you could add walnuts or almonds as well.
That sounds good too.
Yeah, I agree.
Yeah.
Or you could do, a fresh salad with like some mixed greens, add some of that spinach and kale to it. Maybe sprinkle a little bit of sunflower seeds over it, some berries as well, right? Add one of the healthier oils, right? What we had talked about earlier. As a
Maybe some
dressing.
chunks of salmon on top of there.
That's not, but maybe
Tuna.
those of you that like salmon, right? Tuna for sure. A good beet, nice roasted beet.
Mm-hmm.
Some
Yeah.
brown rice, quinoa, some roasted vegetables. All those things, are really good low inflammatory meal ideas.
For
That's what-
dinner, how about some stir fry with broccoli, bell peppers, mushrooms, tofu, or tempeh, and
you
maybe
could
a
actually
little
still have chicken.
served brown rice. Yeah, chicken.
Mhm.
Um,
The Mediterranean bowls that we talked about, right? A lot of people
Yeah.
do that. Those are good.
mhm.
The brown rice, the quinoa, the roasted veggies, chickpea, tahini dressing on it, right?
Yeah, that's good. Mhm.
It is good. I agree.
Mhm. What is that dressing that is you have whenever you go to like I don't know, like Asian restaurants or something like that has that peanut sauce dressing that Mike, you like it. Do you know what
Peanut-
that's called?
Peanut sauce.
No, it's like I don't know. It's kind of a little bit sour and I don't even know, but something like that I feel like would be a good dressing as well. Do you know what that's
Yeah,
called?
it's like a ginger dressing.
Oh, ginger.
Yeah.
You know what I'm talking about, Ben?
Yeah, I do, but I don't know.
Sounds so good.
Oh,
right
I
now.
know. Yeah, like.
It just goes,
And they put it on the like the miso, like the
Yes.
salad that you get. They put a little bit on
Yeah.
the salad. Oh, that is good. Mhm.
Yeah.
It's like a ginger dressing. Yeah.
Okay,
mhm.
ginger. But which is has low inflammatory process or low inflammatory process. It's just low inflammatory food.
Right, which bringing all of that, which is helping you bring the inflammation down, which is causing some of these, arthritises, things like that. And like we said, if we're bringing that inflammation down, then we are also bringing down the flare-ups of the HS that we've been talking about, right?
Absolutely. And another thing, not only that, migraine symptoms too, and migraines, inflammatory. So there's so many things that
And good water intake.
Oh, that's huge.
Uh-huh.
That really, really important. I can't stress that enough. I don't
Enough.
feel like.
Yeah, water is one of the biggest things.
But I think I would hope that this talk was helpful for people. Again,
Absolutely.
you are what you eat.
Which is not going to be that wacko smoothie or this kale salad with salmon. Not me, anyway.
By the way, the fear of like holes and seeing stuff with bumps or patterns are clustered together is called trypophobia.
Amy has that?
No, like seeing like holes and stuff.
No, I know what that is. I'm saying Amy
Kind
has
of.
that?
Yeah,
It's kind of gross.
Oh.
Look it
So
up on your.
I know what it is. So that weird, you see
The
those flowers
pods.
that have the seeds
Yes.
that are out and it has that.
I don't know. It's not that I'm fearful of it. It's just gross to me. So now everyone's going to be Googling that to see what that is. It's just gross.
How do you say that again?
Trypophobia.
Trypophobia. That's not fear of tripe.
It could be.
Sorry,
but
that's just me. Well, good.
Yeah.
This was informative because, going through some of these things, because you know what? There's many inflammatory things that people don't realize can be diet related, right? And we go on with other episodes about it, but I think this is a good idea of, and they're all, we laugh and we joke about these, but they're all relatively normal foods, right? Beets, and I'm just going through beets, cauliflower, avocados, brown rice, garlic, there's things that we're not saying you have to go out and get some kind of exotic stuff, right? Fruits and berries, all kinds of things like that help, which are lower inflammatory foods already. So,
Yeah. I think people will appreciate us diving in a little bit deeper.
well, I certainly do.
Well, I mean, I do too. I mean, I feel like I knew some of these things were anti-inflammatory, but until we were, again.
What one thing on here surprised you is anti-inflammatory? Or that we discussed?
Oatmeal.
See, I've always known,
Like barley.
I mean, oatmeal, they've always advertised that as, helps with cholesterol and heart, right? I mean, that was a big push back in the day. And they still discuss that, right? Yeah, barley, I didn't know.
Yeah, so I was just thinking that.
I do make a
those
really
types
good
of
beef and
things.
barley soup, by the way.
Oh, you can make that for us sometime.
I could, but will I is a different, depends on if Amy signs up for that higher level of meet and greet, because then that includes a meal. Right?
I'm out.
Oh. Well, on that note, she's out. So thank you for listening to us. You can
Yes.
find us on all of the social medias, all of the all of the podcast platforms and things like that, right?
The Heavy Truth. We appreciate you listening and
do.
always, welcome feedback and ideas for future episodes.
Yes, write in. Tell us. You can just write in and say, you suck. Thank you. But, at least we're hearing your responses and what we need to change or what you want to hear. So until next time.
For The Heavy Truth, I'm Amy.
And I'm Dr. Ben. Bye.
Bye.